personal.
This time of year, we all want to feel our best. Hopefully the season has been a healthy one for you. But when there comes a time and you need some emergency care, you want an emergency room close by. Let me introduce to you Chris Cosby. He is the CEO of Parkridge Health System. Good to see you this morning.
Hey, good morning.
So I know you're kind of hoping for Christmas, a lot of public support up Bradley County way. You're looking to build a new ER up there.
We are. You look at Bradley County and the growth that's happened, and they only have one choice. They need options. They need a choice. They need the ability to make a vote with their feet. You look at Bradley County, and right now about 35% of their population is driving into Chattanooga when they need health care.
Right.
So why not bring it closer to home?
So what you have to do, though, to bring this closer to home, it's kind of a true grassroots effort. You're kind of going door to door, asking people to say, hey, join us in this support so the state will approve us.
Absolutely. So we need a certificate of need. And January 28th, we go for the hearing. Hopefully we get approval. So in the meantime, I've spent the past 4 weeks in Cleveland and southeastern parts of Polk County because it also affects Polk County. So really establishing relationships, somebody know what we can bring to the table, but we really need their support. So you hear the words closer together, better together. I agree with that. If we go to parkridgeclevelandER.com, they can fill out a form. It'll generate letters of support. So really, let's be together and let's go get this ER. So
your timeline's, I think, pretty aggressive, pretty optimistic. If you get this approval on the 28th, you're not wasting any time. You hope to have the ER ready to go a year later.
Yeah, so usually about 2 to 3 months to get permits and get architects going. And then once we break ground, it's 10 months. So this would be our 4th freestanding ER in the region. And so we kind of have a fine tune, and these go fast.
I'm just returned from a trip out of town the last few days, and some coworkers of mine were also gone, I've learned, and several people have come back sick. Flu-like symptoms. When I said this is not the time of year that you want to be sick, but boy, when something like that happens to you, much less a real emergency, you need that ER close by.
Minutes matter. Right? And the quicker you can get to an ER in a situation, we have an emergency situation, the minutes matter. And so, I'd like to make one comment. I keep getting questions when I'm in Bradley about transfers. And our job would be to make sure that you get informed about what's wrong with you, because when you access health care, especially in emergency anxiety, it's through the roof. You're scared to death. You're looking for an answer.
Right.
And so our job is to help educate you, inform you what's going on with you, and then allow you to make the decision on where you would transfer to from that ER.
Okay, so in other words, if they see you in Bradley and maybe it's a cardiology issue, a concern, you're saying that they have the option to stay within your Parkridge system or go to somebody else?
Absolutely.
Okay.
It is, healthcare is personal. And so it's our job to care for you like family, help you make an educated decision, and let you choose where you go next.
Okay, let's come down Chattanooga way then for just a second, because y'all do have some plans too at your main campus on McCauley. I'm going to kind of segue it into this. I think that when you do have those emergency situations, I've certainly been this person, you go to the ER and you kind of are expecting something maybe that the ER can't provide, right? The ER is how to stop the bleed, so to speak.
Right.
It's not the continuing of care.
Right.
But your plan is to try to build this new tower on the campus.
We broke ground this past May on a new patient tower. Very excited. It's a $98 million expansion. So we're adding 3 floors. So the first floor will be a nice new lobby, a coffee shop, and some other registration stuff. But the real part of our patient care in the new tower is on the 2nd floor. We're going to add 16 ICU rooms, brand new ICU rooms, and we're going to have, the way it's designed, we could add another 16. So eventually it'll be 32 brand new ICU rooms. The 3rd floor will be 32 brand new med-surg rooms. And then the way the steel structure is found in the concrete foundation, all that, and the footers, we can add 2 more floors on top of that. So a 4th floor and a 5th floor. So eventually we will. It'll be 32 more beds on the 4th floor, 32 more beds on the 5th floor. So that's $98 million, but all the other projects we have with new ORs, renovated ORs, expanded ERs on the main campus, it's about $140 million in flight and capital.
The competition for qualified doctors, I'm sure, is intense. Doctors have kind of become almost small business owners in a way. So having the support of the hospital behind them, where y'all are kind of handling the business side of it and they can handle the healthcare side of it.
We need to make sure doctors who are highly trained individuals have the time to take care of patients. It's our job to make sure they're resourced with what they need, whether it's staff, whether it's equipment or new technology or bed, access to bed or supplies. It's our job to make sure they have what they need in their hands so our patients get the care they deserve.
I won't go name dropping, but I'm thinking of a couple of doctors I know who have been with Parkridge for a long time. I know you're fairly new to the Chattanooga part of it. You've been
Right
here
at 3 years.
But that speaks volumes too, right?
Yeah, absolutely. We've got doctors who have been with us a very long time. We've got doctors who practice in this community who are now shifting over to Parkridge. I've got 4 new doctors who will be joining us in the spring, and brand new. They've been in Chattanooga for a long time. Excited to have them part of the Parkridge family.
Okay, so back now to the real kind of most pressing need at hand is to get this community support, I guess.
That's right.
For the Bradley County expansion with your ER.
That's right.
So it's not a lock if you don't get this public support.
It's not a lock. We have to go up in front of a committee in Nashville on January 28th. We'll go tell our story, and I'm sure we will be met with opposition from the other side saying why there shouldn't be one. We believe there is. We think the residents believe there should be. But yeah, we need their support.
Sorry, but what is the opposition? What would be the reasons that somebody would be against it?
Because Bradley Medical there has, they have an ER, and I understand they would want to fight that. Yeah.
Okay. Just the simple capitalistic competition
100%,
type of a thing. Okay.
Nothing personal to anybody. It's just that's competition.
I gotcha. You don't care about that so much when you're sick, and we are in the stroke belt.
That's right.
We are in a part of the country where there are true emergencies, traffic accidents that happen. That Bradley County to Chattanooga corridor there on 75 is not a good one.
No, minutes matter. I mean, I think that's what I want people to realize, is that it's our job to bring care to you closer to your home when minutes matter. Okay, well, here is what you can do if you want to learn more about this. First of all, be watching for them. They're coming around in the Cleveland, Bradley County area, and Polk County, you're part of this too. If they want to go to a website to learn more, can they do that? Absolutely. They go to parkridgeclevelander.com. Okay. Let's be better together. Let's work together. Let's go fight. Get this for y'all. Okay. And so it's parkridgeclevelander.com. You fill out a few little things, and then it will automatically generate a letter of support. Perfect.
Hi, I'm Kevin Bragg with Bragg